So in this video, we're gonna practice 11 question about nitroglycerin, right? And I just wanna let you know that these questions are, I did not create it. These questions are available online for free practice, right? So I got all the question from online sources and we're gonna practice together. So yesterday I posted a video regarding nitroglycerin, right? This is regarding knowledge that I share with you about nitroglycerin. And today in this video, I'm gonna go over 11 practice question. And if you have seen that video about nitroglycerin yesterday, you will be able to crack all of this answer immediately. So let's practice 11 questions. If you have not watched that video yet, watch it. I posted yesterday. So here are practice question 11 practice question. Let's do it. First question, a client with acute myocardial infarction is prescribed nitroglycerin, right? Sublingually, right? The nurse should monitor for which common side effect? So what is the common side effect that I mentioned? So there are three things that you need to monitor when you're taking sublingual medication. Sublingual means under the tongue. The patient will drop under the tongue. So common side effect are hypotension. It will cause drop in blood pressure. Because drop in blood pressure, the perfusion is not reaching to your brain, so patient will complain of headache. So hypotension, low blood pressure, headache, and facial flushing is common three symptoms, right? So what is the answer in this one? So which is the most common side effect? So common side effect is headache. That is your first answer. It will not cause hypertension, it will cause hypotension, because less blood pressure, low blood pressure will cause hypotension. It will not bradycardia, it will be tachycardia, because once the blood pressure drop, in response the heartbeat go up, so that means tachycardia, right? So that's our first answer, answer C. Next question, a patient present to the emergency department complaining of chest pain, right? The HCP has ordered sublingual nitroglycerin. Which assessment finding would prompt the nurse to hold the medication? So A, B, C, D, what do you think? So in this one, as I mentioned, this medication will drop the blood pressure, right? So if the patient blood pressure is already 88/50 in this one, the option D, that means if you give this medication, it will drop more significantly low, right? So that means answer D you have to select. So hold the medication if blood pressure is already 88/50, right? See, if you have watched the lecture, if you have watched the video that I posted yesterday, it's going to be very simple for you to answer this all question. And during your Nclex, when they ask you, you will be able to crack all your answer immediately, right? Again, I repeat, watch that video and you will, this question is going to be very simple for you to crack it. Third question, the client informed the nurse that the physician just prescribed sublingual nitroglycerin tablet to take whenever chest pain is experienced, right? The nurse informed the client that the correct way to administer nitroglycerin is to place one tablet. Where you gonna put? As I mentioned, you have to put this tablet under the tongue, which is called sublingual, right? So that's answer A. Easy. You don't put it in the cheek area, you don't drink with the water, you don't chew or you don't engulf. Put it here and let it dissolve its own. And if patient complained of sensation of burning, that's a normal, that's mean the medication is effective and active, right? Simple. So under the tongue is your right answer. Next question. In this one, a nurse is caring for a client receiving nitroglycerin therapy for acute angina. Which of the following nursing action is the priority? So this medication, as I mentioned, will cause drop in blood pressure, right? So what are you gonna do? What is the priority? The answer is already given. Monitor the client blood pressure closely for hypotension. So easy, huh? It's already selected and given. So even it's not given, you should be able to crack it. This medication is vasodilator. It will drop the blood pressure, right? So answer A, you watch for hypotension. Next question. Sildenafil is prescribed to treat client with erectile dysfunction. A nurse review the client medical record and would question the prescription if which of the following is noted in the client history. That would be answer what? Answer C, use of nitroglycerin. Why? Because nitroglycerin, as I mentioned in the video earlier, the previous lecture video, you should not take nitroglycerin with erectile dysfunction medication sildenafil. The reason is both medication is vasodilator, right? So both medication Both medication will drop the blood pressure extremely low and could cause major problem, possible death. So that's why you should not combine nitroglycerin with sildenafil. So if patient tell you that he is taking that one, that will immediately nurse would ask the question. So answer 3 is your right answer. Don't take nitroglycerin with sildenafil. Next question, which of the following are side effect of nitroglycerin? Select all that apply. Okay, select all that apply. Side effect. What are the side effect? Headache. When you're getting multiple option, you have to treat like true or false, right? So let's do it. Headache, true. True or false? Yes, patient will complain of headache. That's a common side effect. Yes. Hypertension, false. We will have hypotension, right? So hypotension, yes. So you at this time you have A is correct, headache. Hypotension is correct. Tachycardia, yes, because when the blood pressure drop, the heartbeat go up in response. So tachycardia is correct answer. Bradycardia, no. So your correct answer are headache, hypotension, tachycardia, right? Next question, a client is to be discharged home with a transdermal nitroglycerin patch. Which instruction will the nurse include in the client teaching plan? Apply the patch to a non-hairy area of the upper torso or arm. That's the correct answer, right? So patient should apply this patch upper torso, non-hairy skin part. So medication can absorb in your skin, right? So the answer A immediately, that would be your right answer. Apply the patch to the same side. No, you don't apply on same side. You have to rotate side all the time. If you have a headache, remove the patch for 4 hours, then reapply. No, that's a common side effect, headache. It in the beginning, patient will feel headache, but once the therapy started, slowly it will disappear. If you have chest pain, apply a second. You don't apply second patch. So answer A is your correct patch answer. And you leave the patch for 10 to 14 hours at least. And in the night time, you remove it. So patient won't get dependency. Next question is, which statement made by the client demonstrate a need for further instruction regarding the use of nitroglycerin? If I get headache, I should keep taking nitroglycerin and use Tylenol for relief. I should keep my nitroglycerin in cool, dry place. I should change position slowly. So question is saying which statement made by the client demonstrate a need for further instruction. So that means further means which option is wrong here. Further means which option is wrong here. So if option A, if I get a headache, I should keep taking. Yes, you should continue taking because that's a common side effect. I should keep my nitroglycerin in cool, dry place. That is also correct. You should keep it there. I should change position slowly to avoid getting dizziness. Yes, because this medication causes low drop in blood pressure. Should you tell the patient to get up slowly. I can take up to 5 tablets at 3-minute interval for chest pain. That is the wrong answer because you can take only 3 tablets every 5-minute interval, right? So you take first tablet, wait 5 minutes. If pain is still there, you call 911 and you take second tablet and wait another 5 minutes and then take third tablet, right? So answer D, that's the wrong answer here. You don't take 5 tablets, you take 3 tablets only. What will the nurse instruct the client to do prevent the development of tolerance? So apply the nitroglycerin patch every other day? No. Switch sublingual? No. Apply the nitroglycerin. C, option C is your correct answer. Apply the nitroglycerin patch for 14 hours and remove it for 10 hours so patient will not develop tolerance. So that's why you have to give 10-hour gap. You apply in the morning, you remove it by in around 8 or 9 o'clock in the night, and then leave it off for 10 to 12 hours. And then next day you apply again. The client asks the nurse how nitroglycerin should be stored. How nitroglycerin should be stored? What is the nurse best action? So you can protect it from heat by placing bottle in the ice chest. No, it's the best to keep it in the original container. So option C, you have to keep this medication in cool, dark place away from the heat or light. Otherwise, if you expose this medication to heat or light, it will reduce the efficiency of this medication. So option B is your correct answer. It's best to keep it in original container away from heat and light. You can put a few tablets in reasonable bag. No, it's a bag. Best to lack the no. So option B is your correct answer. Which statement indicate to the nurse that the client understands sublingual nitroglycerin medication instruction? So what do you think? I should sit. I will take up to five doses. No. I can chew the tablet. You cannot chew, you have to let it dissolve its own, right? I will keep the tablet locked in a safe place until I need them. I should sit or lie down after I take nitroglycerin tablet to prevent dizziness. That is your correct answer. Because as you know, this medication will drop in blood pressure. So tell the patient to lie or sit down after taking this medication. Right. So that's the wrap up of all 11 practice questions. So if you have watched the yesterday video, this question is gonna be super easy peasy lemon squeezy for you guys.